For our delegation scenario, we had number 4, patient overview. Miss Davis is 50 years old, woman. Her diagnosis is congestive heart failure. Her heart isn't pumping blood effectively, leading to fluid buildup. Her past medical history is hypertension or high blood pressure and peripheral vascular disease, which is poor circulation in the limbs. 2+ BLE pitting edema, so both of her legs are swollen with moderate fluid retention. Pressing the skin, it leaves an indentation, which is how we knew. She gets shortness of breath when she moves around or exerts herself. She also has wheezing, so when we listen to her breath sounds, it was like a whistling sound. This is often due to fluid in the lungs or narrowed airways. Her family's concern is that she doesn't like hospital food and wants to bring food from home. This is important because congestive heart failure patients must follow a cardiac diet, which is going to be a low sodium and low fat. Outside foods could worsen the fluid retention if it's salty and not heart healthy for the client. The doctor's orders is to check vital signs and do this every 4 hours. Her cardiac diet is low in salt and low in fat to reduce strain on the heart and prevent the further fluid buildup. Strict intake and output, carefully measuring everything that she drinks and all urine output to monitor fluid balance. Her daily weight should be taken, and sudden weight gain can mean that she is building up more fluid. We need to be able to give her oxygen at 2 liters through a nasal cannula, adjusting as needed to keep her oxygen saturation above 95. Next, we're going to look at CNA and UAP, what can be delegated to them. Vital signs, daily weight and intake and output, assisting with meals, and basic hygiene and comfort are all things that a CNA and UAP can be delegated from an RN because it doesn't require anything that is outside of regular routine, and it doesn't require any critical thinking or even anything outside of their scope. So with vital signs, this is a routine skill, and the RNs can check for abnormalities. For daily weight and intake and output, measurements as well as recording findings are under their scope of practice, and the RNs can again evaluate trends that are present that might be abnormal. Assisting with meals are another thing that the CNAs and UAPs can do as well, assisting with things like feeding and recording the amount of food they consume or the intake that they have. Basic hygiene and comfort, so this could be ambulating them or repositioning, supporting the patient, and also bathing them. These are all things that can be delegated to a CNA or UAP because it doesn't require, again, the critical thinking, and are also routine checkups that need to be regularly done.
Hi, my name is Evelyn and today I'll discuss a delegation of specific tasks for Mrs. Davis, a 50-year-old who was diagnosed with congestive heart failure. So to start off, you have the LPNs or the LVNs, which can be delegated several tasks that support her ongoing care. They can administer oral medications, so they can give medications such as diuretics and other prescribed drugs to manage her congestive heart failure. Also, some IV meds can be given depending on the state of practice regulations for the LPN and the LVNs. Then you have the oxygen therapy. So the oxygen therapy, they can operate it, and they can also monitor the saturation stats as well for Mrs. Davis. And they can also reinforce education, but they are able to support the learning after the RN initially teaches the patient. Then you have the RNs. So the RNs can be delegated assessment of patient. They can come up with a care plan for Mrs. Davis and ensure that she is in good health and just improve her overall health in general. And then you have the monitoring. So the monitoring for Mrs. Davis is basically just to keep her safe. And it is an indicator of the patient health. Then you have the implementing or monitoring of fluid. So it's basically just to keep track of fluid limits, measure fluids that were consumed, or keeping track of Mrs. Davis' edema. And then you have blood sample collection. So RNs can be delegated blood sample collection to run blood tests or diagnosis, further blood tests or diagnosis actually, and then to give an insight of her overall health, like continuing her stay at the hospital. Then you have the assessment of respiratory status, example, wheezing and dyspnea. So this helps to recognize the signs of worsening heart failure for Mrs. Davis and also any respiratory distress, current or in the future.